Mara Williams. We're going to start doing Ask Mara. So please, if you have questions you would like answered, please post them on Nature's Dirty Needle on Facebook or on Nature's Dirty Needle YouTube. Today I'm going to talk about basic testing for Lyme disease, what is valuable and what you should just ignore. Because the Infectious Disease Society and its guidelines are a detriment to the diagnosis and treatment of Lyme disease, you need to understand that if you go to your primary care physician, the first test they'll do is called an ELISA antibody for Borrelia burgdorferi. This test is consistently a false negative. As much as 75% of the tests done come back negative, and they're not really negative. If this test comes back positive, good for you, because you might get some attention out of this. And the next thing they will do is send a Western blot with Lyme-specific bands to either Quest or LabCorp, the two largest laboratories in the country. The unfortunate thing about both of these tests is that the IgM version of the Western blot, they only test 3 Lyme bands when there are about 6 or 7 Lyme-specific bands, and so they don't do justice to the test. And IgG, they actually will do almost all the bands. If you have one positive band on these tests, you are positive for Lyme. I don't typically run these tests unless somebody has good insurance and we can try it. The next best test is through a lab in Palo Alto called IGeneX. IGeneX does all kinds of tests. They do what's called PCR, which is a culture. They do urine tests, and they do serum tests. They do the Western blot, IgG and IgM, which I like to run because I can frequently get a positive Lyme test with that if you have it. If you are acutely bit by a tick and you come see me, I would put you on antibiotics for a month and then run the test. And I'll tell you, the results I'm getting are pretty interesting. I'm getting an indication of Lyme probably 8 out of 10 acute tick bites here in California. Right. Other tests, they have co-infection panels. My recommendation to you is to save yourself some money, is to do only the Western blot, IgG, IgM for Borrelia burgdorferi, which costs about $260. And if you want to do co-infection panels, do Bartonella and Babesia, by Babesia duncani on the West Coast and Babesia microti on the East Coast, and only do the IgG, IgM, which would cost you $200. No, I think actually it's $135 for each of those tests. Forget the PCRs, forget the urine tests, forget the blots, forget everything but those particular tests at IGeneX, because they typically come back negative, and clinically you show symptoms of those co-infections. So most Lyme literate doctors will treat clinically regardless of what your tests show. The definitive Lyme test for Borrelia burgdorferi, or any spirochete, Borrelia spirochete, is the advanced lab culture. Unfortunately, it costs $600, but they will run it for 4 months to see if something grows. In this particular instance, you want to have been off of antibiotics and off of any kind of herbal treatment, any kind of treatment that kills bugs, for at least a month before you do the culture. It can sometimes come back negative, which doesn't necessarily rule out Lyme. However, if it comes back positive, you have Lyme. There is no question about it. We are hopeful that more tests will be coming out shortly. But those are really the only ones worth looking at as far as I'm concerned. I hope you enjoyed Ask Mara, my first Ask Mara. Be sure and leave your questions at Nature's Dirty Needle on Facebook or on YouTube. And consider buying a copy of Nature's Dirty Needle and sharing it with your friends and family. It's a wonderful primer, and it will help them understand what you're going through.